What is in vivo exposure for PTSD? Imagine facing a situation or place you've been avoiding because it reminds you of a traumatic event. In vivo exposure for post-traumatic stress disorder is a therapy technique that helps people confront those real-life triggers in a safe and controlled way. This approach is part of exposure therapy, which aims to reduce fear and avoidance behaviors that keep PTSD symptoms going. In vivo exposure involves gradually and systematically exposing the person to actual situations, objects, or places they find distressing. For example, someone who experienced trauma in a crowded place might start by visiting a less crowded area and then slowly work up to busier environments. The goal is to help the brain learn that these situations are not dangerous, which decreases the fear response over time. This therapy is often used alongside other treatments like imaginal exposure, where the person revisits the trauma memory in a safe setting. Combining these approaches targets both the internal memories and external reminders of trauma. In vivo exposure is usually part of evidence-based treatments such as prolonged exposure therapy, which is widely supported by research for treating PTSD. During in vivo exposure, the therapist and patient work together to identify specific avoided activities or environments linked to the trauma. The patient then practices approaching these situations outside of therapy sessions, often called homework. They monitor their anxiety levels and gradually increase exposure to more challenging triggers. This step-by-step process helps build confidence and tolerance, making it easier to face everyday situations that were once overwhelming. It is important to note that in vivo exposure is carefully planned and supervised by a mental health professional to ensure safety. The process is not meant to erase painful memories but to change how the person relates to those memories and triggers. Over time, repeated exposure helps reduce the power of these triggers, leading to fewer symptoms and better daily functioning. Practically, in vivo exposure might involve returning to the scene of the trauma, engaging in social activities that were avoided, or confronting objects that cause anxiety. The therapy is tailored to each individual's needs and comfort level, progressing at a pace that feels manageable. In summary, in vivo exposure for PTSD is a key part of exposure therapy that helps individuals face real-life reminders of trauma. By doing so under professional guidance, they can lessen their fears, decrease avoidance, and improve their overall quality of life. Always consult a qualified mental health professional to determine the best treatment plan for your unique situation.